What's up, guys? How's it going? Cade More with More Muscle. Today we're gonna be doing some more practice mental health questions. So, guys, let's get to the first question. A client has depression and states he feels down. What should you do as a nurse or healthcare provider? The first thing you want to do is ask if they're thinking of harming themselves. That's very important. And then follow up and see if they have the means to do it. Next, a client who has bipolar disorder and just started mania. So they're manic. They're probably pacing. They're having extreme amounts of speech. They're not resting. They're maybe getting 2 to 3 hours of sleep a night. That's mania. So what you want to do for the answer would be you want to ensure frequent rest periods. You want to give them a high calorie, high protein diet. You can sometimes even do finger foods, where you just hand them the food and they can eat it. You want to decrease stimulation. You want to inhibit caffeine, because caffeine is going to amp them up more, and you want them to relax because mania is an extreme state. Okay. Next is, what is agoraphobia? The answer is avoidance of places or situations that are difficult to escape. For example, fear of leaving home or open places such as malls. Question. Repeated hand washing is a sign of what mental illness? And the answer is obsessive compulsive disorder, or OCD. Usually with OCD, they're doing these repeated motions, not for attention seeking, but it's for getting rid of anxiety. They might have a fear of excessive germs on their hands, and they wash their hands many of times. I know a couple people like that, and OCD, there's a lot of things that you can do for OCD, and a lot of it is, you can tell the behavior, like stop. You can say stop really loud, and you can try and prevent that thought from reoccurring. Okay, guys, the next one. A mental health client starts with some rage and tries attacking another client. What should you do? Well, the first thing you should do is do the least restrictive method, right? So you want to tell them to stop. Next restrictive would be like administer medication if they don't, and you'd even have to seclude or restrain the client if the client's still a harm to other people. What is the highest priority for a patient who has bipolar disorder and is manic? So the client has been only sleeping 2 to 3 hours. So the biggest priority is stopping extreme exhaustion due to lack of sleep, or just excessive movement, excessive speaking. A lot of people with mania, they just don't feel exhausted, and that's the biggest concern, is their extreme exhaustion. Okay, a client who has depression states that he doesn't want to attend activities. What should you do? The answer is, you want to say, hey, it is important for you to attend activities, because this will help with their treatment plan, and this can reduce social isolation. Guys, working at a mental health facility, they basically, you're always around people. Like almost 90% of the time you're around people. Social isolation is bad for mental health. Being around people can uplift your spirits, and it can increase your happiness. So there's that. Next thing, a client with depression gives away possessions. What is he at risk for? Guys, if a client says, hey, you can have this, I don't want it, and he's giving away all his prized possessions, or he's getting his affairs in order, that's usually a sign that he might commit suicide, sadly. But you want to monitor that. And the next thing is, a client has a physical dependence on alprazolam and needs to stop taking the medications. How should the nurse or healthcare worker stop giving the medications? You want to taper the medication slowly over several weeks to minimize withdrawal symptoms. And you want to monitor withdrawal symptoms. So tapering is really important. So just giving smaller amounts every single time until they're finally off that medication. Okay, what are some manifestations of Alzheimer's disease? Answer would be impaired judgment, personality change, memory loss, or this is also progressive. So far there's no Alzheimer's, there's no medication that can reverse Alzheimer's disease. There's medications that can slow it down, but the difference between Alzheimer's and delirium is that delirium is rapid and Alzheimer's is progressive. So anyways, guys, if you like this, subscribe, please. Thank you.